I guess in public health, the one tip, I give everyone is that reaching out, making connections, and, really working on your communication skills is key to really move forward and, sort of work towards your goals and whatever, the issues that you want to work towards. So I'm glad I reached out, and I'm so happy that you made this specific platform, space in your platform for students. I'm sure you're gonna have many students show interest in being part of your show.
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 63. Student edition, our first and ever student edition. I'm really excited to be bringing you all this new section of the show to really highlight some public health students and the great things that they're doing. And I know it's just another way to get people on, share my platform to really elevate other people and let them share so that the larger public health world knows about them and the work that they're doing. Be sure that you subscribe. Be sure that you are liking these. You left a review. I would greatly appreciate that. Share it with a friend and go to buymeacoffee.com/the PH Millennial if you want to support there as well. But if you subscribe and leave a review, I'll greatly appreciate this. I'm excited to bring you today's guest, the first guest in the public health student, Public Health Millennial Career Stories Student Edition. I know she has some great insights and is going to be doing some great things. So without further ado, thank you for joining, and I hope you all enjoy. Marwah Azizi is a published STEM and public health leader, experienced mentor, and academic associate with over 3 years of experience in medical, academic, and higher education settings. Marwah is the founder and president of CHL, or Connect Public Health Leaders. CHL is a newly formed and fast-growing organization which aims to address Canada's most pressing health challenges. During the time she has worked and volunteered in these environments, she has learned to go beyond the limits to complete tasks. Marwah is in the third year of her undergraduate degree focused on public health and safety at Ryerson University in Toronto, Canada. Marwah is an advocate for holistic public health approach in Canadian healthcare system, in refugee and immigration rights and mental health, and has a great passion for research on cancer and infectious diseases and the epidemiological aspects. As a public health student, Mara believes that many of the contents learned in the classroom directly applies to how students and professionals advocate and stand for what they believe needs public awareness. Welcome to the show, Marwah Azizi.
Thank you so much, Amari. Thank you for putting your platform to me. It's amazing to see that you bring public health professionals and our students to your platform to raise awareness and address public health issues. So I really appreciate it. Thank you for having me.
It truly is my pleasure. I definitely see you doing a lot of great things on social media and in public health just in general. And just to like put like a point to this, like I want to let everyone know that you reached out to me like a couple months ago, and at that point in time I just wasn't ready for this, but it is something that was bubbling in my head. So just that act of reaching out kind of forced me to think about this more deeply, and it also shows that you got to reach out to people when you want opportunities, and you never know, like at that point in time I said no, but now we're doing this and you're going to be the first student guest, and I'm really happy to have you.
Likewise here, absolutely, I agree. I guess in public health, the one tip, I give everyone is that reaching out, making connections, and, really working on your communication skills is key to really move forward and, sort of work towards your goals and whatever, the issues that you want to work towards. So I'm glad I reached out, and I'm so happy that you made this specific platform, space in your platform for students. I'm sure you're gonna have many students show interest in being part of your show.
Oh, I hope so. I hope so. Well, having you on is going to be a great start. So as I said, like I'm just really happy to have you. So tell me, where do you go to school and what do you study?
Sure, yes. So I go to Ryerson University here in Canada, Toronto, and I'm an incoming third year public health and safety student. I'll be starting my third year in September, and we're still not sure if it's going to be in person or online, but I am excited either way because in the program. It's most original and longest running program in Canada of its kind, and we have a very well-rounded education. We learn from epidemiology to law to health policy. And when I first entered the program, I really wasn't sure what to expect in terms of the various disciplines I'm going to be exposed to. But honestly, I could say that I'm surprised every semester. Like even though I know my courses, but it really is something interesting. Like every course is so well put together and is very up to date, and it's stuff that's happening around us like right at the moment. And so I remember my first semester when I had my law course, and it was very tough because I'm not a law person. I'm more of a science person, hence why I chose public health. But there is also aspect of law within public health. So I remember a professor telling us the definition of pandemic. So and he said, you guys don't have to worry about it. It's not going to happen, at least not in your lifetime. And we all had a good laugh about it. But to think that it happened a year after we learned that, it was really, I guess I could say, shocking because everything was new to us. And after that, obviously we now everyone knows what a pandemic, what an outbreak means, and all that. And I wish we didn't have to, but it also we also learned that how much we need public health awareness, how much the governments needs to invest in public health initiatives and organizations, because here in Canada, specifically in Ontario, the province of Ontario, the funding was significantly cut to those organizations. And so must have heard that we had our third wave, and it was very tough. The healthcare workers, it was very tough on them, and obviously on public as well. And it was all the result of not investing in these organizations and initiatives and thinking that okay, these things are not going to happen. While we work to prevent these, there's always a chance that it can happen at any time, and we can't really predict the extent of the damage. So yeah, and I guess this program that I'm in, it really prepares us for that, and we get a very balanced education so that when we graduate, we are well aware of every aspect of public health.
That's amazing. It sounds like it's a really immersive program, and you definitely get to learn as you go and like learn about current topics that are happening in public health. And I absolutely err on the same side of you. Like public health has been underinvested for a long time, and just like in Toronto, it's the same in North Carolina where I am, and many other places around the world. I would imagine, and I hope that the pandemic has shown the light that we need to
Oh,
invest in the
absolutely.
infrastructure.
I remember my first year when people would ask me, or my relatives even, what I'm studying, and they really had no idea what public health was. I mean, I didn't know what public health was. Like I sort of stumbled upon the profession. But couple months into the pandemic, like as soon as I tell someone I'm studying public health, they have this response. And I guess it's and we see a lot of sort of increase in the applications that university receives into their MPH program, which is Master of Public Health, or their undergrad programs, which shows that there's a lot of interest, and obviously there's a lot need in the community for public health professionals. So it's great to see that we are learning many lessons from the pandemic, and hopefully moving forward, we're going to have better responses in the future.
Absolutely, absolutely. Especially with people like you coming up in the field, we definitely have those responses. So I look forward to your leadership in many different ways going forward. So tell
Much
me how.
appreciated.
Yeah. Of course, of course. You speak for yourself, and you're doing great things. Like everything that I see from you online is amazing, and I just love that. And I want to get back to that, but before you mentioned that you stumbled into public health, tell me how you
Right.
stumbled into public health.
Yes. Well, it still is my plan, and initially I wanted to go into medicine. And so we're well aware that students choosing to pursue medicine, they tend to go with the traditional pathways of either pursuing biomedical science, biology, chemistry, and while there are absolutely amazing programs, I always knew they weren't for me, even though I did apply for them. But I just knew that that was the only way that I kind of I could boost my application to just, have a science background. And just a few weeks into the application, so how we do it in Canada here, I'm not sure how it works in the States, but we submit the application and then we have a couple weeks between that to either, drop a program or add a program. And so I went to visit Ryerson University. Just, it was a sort of like a view of the campus and all that. And so I was looking into, any other program that was not heavily invested in sciences. So, and that's when and also a friend of mine applied to the public health program. So that really got me thinking and searching about, what it really means. I had no, even the public health, like it's really sort of speaks for itself, but I didn't know what it was, or what kind of curriculum it had. So the more I looked into it, the more it piqued my interest. And I kept telling myself, this is me, because I don't want to be, and focusing only on the sciences. I'm a curious person. I always want to know more about the world. And it's not only about sciences, right? So when I saw that it has, this every other aspect of epidemiology, toxicology, health promotion, and I was like, how can a program, have so many aspects? And so I was sure. And honestly, I wasn't sure that, I would get in because it was a bit late, but I added the program anyways. And within a couple of weeks, I got an early admission, which was, one of the happiest moments of my life, because I knew that that was what I wanted to go into. And even now that I'm going into my third year, my plan still hasn't changed of pursuing medicine, but I know that if at any point I decide not to go with medicine, I have already found a dream career. Like I could say that I have two dreams. Like one of this is accomplished, which is public health. I love working with people. I love being involved. I love, working towards addressing and tackling health inequities in my community. And so that, for any reason, if I don't make it into medicine, which is quite competitive, but it won't be because, I couldn't make it. It's because, that was my decision and I love what I'm doing currently. And so, which is why I'm thinking of doing a Master of Public Health before I apply to med school, because, you have a lot of resources for MPH students, and also I've seen a lot of other, influencers doing the same on social media platforms. So I'm really interested to see, what a MPH, would sort of, equip me with to, just serve my community. So yeah, that's basically the story. Like it was pretty. I was pretty happy with my decision, and I'm glad that I don't look back and say I wish I had gone to this program, because I'm so sure with my decision and so confident. And by every day that I spend within my classes, it only gets like I only get confident in my decision that this is what I want to do.
That's awesome, and that's amazing that you said that like you found two dreams, and even if you don't go on to medicine, you know that
Yes.
you found this space in public health where you can do work that you really enjoy, and you're doing a great job at it. So I hope that you stay in public health. I'm just gonna say that, but I'm gonna let you
Absolutely.
choose.
I guess every time, I get asked that is so, public health and medicine, like how come these are, why didn't you choose like a more, science focused degree? And I guess it's important to address that, prevention before treatment. I guess we had sort of talk in the comments. I remember a year back, I had one of these posts, and a lot of people showed interest that yes, prevention before treatment, because if we get to prevent a disease in our community, prevent, a harm, then first we would be saving our community from going through all the, harsh treatment plans. And second, we'll be saving a lot of money, which could be invested back in the prevention side of it. So I guess even as a physician, it's important to know that, working towards prevention is very important than treating it. So yeah, I guess, having that background will also help me, become a physician that will, be invested in public health before I'm invested in medicine.
I like to hear that. I like to hear that because I do believe you could be a doctor and doing a lot of public health things, but you have to be very intentional in it because the system that you're set up in it just like forces you to focus on the treatment aspect a lot
Yes,
more.
yes, I've had many talks with physicians that work in the community, and I've heard how the medical school curriculum has changed so much of their focus towards public health. And so I remember speaking with one of my mentors who also happens to be a physician, and they told me that, well, if you want to pursue medicine, then public health is the best program that you could go into, because medical school is heavily invested in public health now. And that really kind of, brought the curious me, like, why is it that? And they said, well, there's been a lot of, cases of where, you know, unintentional harms have been done towards patients, and those all have to do with health promotion, and how our physician or healthcare workers are not again intentionally biased, but these are things that have not been addressed in med school. And so a lot of it, as you mentioned, is based on treating. And while that's important, I guess it's also important that you establish that relationship with your patient, which has to do with how you are educated in public health. And so that's why they said that medical schools, a lot of the curriculum now focuses on public health, all the aspects of public health before they get into the treatment of patients. So I really love that, that they're working towards that, because as an immigrant, I face a lot of, I could say, health inequities when I came to Canada. But thankfully, there wasn't this language barrier for a long time. I got to fix that with more schooling and more classes, and same for my family. Like, I got to advocate for them. And so it's not the case with families that come to Canada, and not all of them have the same resources that I had, which is why I think it's very crucial to advocate for them, and to address these inequities that the immigrant and refugee population faces. And it has only gotten much worse since the start of the pandemic. A lot of the cases that we receive are in the immigrant and refugee population, and the least of these vaccination rates are in this population, which is not, I'm not going to say shocking, because it's sort of expected. That's how the system has been built, and it's not going to be easily changed. But I guess with more advocating, more we can sort of at least bring that topic to the table, and have that uncomfortable conversation. And so hopefully, I guess, at the end of and the other side of the uncomfortable conversation, we're going to be able to see some changes.
Yeah, absolutely, absolutely. I'm definitely seeing like Marwah for president or something like that. So I'll be looking, I'll be looking out for that.
That's so kind of you.
Of course, of course. But yeah, I definitely agree with everything you said there, and that's great. That I don't know what medical school that is, but I hope that more medical schools are taking that approach and really building up that public health and
Yeah,
prevention more than our treatment, and just getting into the mindset of prevention as a way to stop from having any treatment as well. Um,
absolutely. Yes.
yeah. So do you have actually tell me a little bit about how you have all this confidence as a young lady student doing all these things, because I see you online and you just elude a lot of confidence. So how have you built up that mindset or and all of that?
Well, first of all, thank you so much, Maury. I'm very grateful for our connection and our relationship for the past 2 years. And I'm gonna say I'm not always this confident. I always have, like, we always have our days. And as you said, as a young professional who's still learning, and I haven't even graduated yet. I just had this when I first reached out at this to you guys, and you were part of my public health series. I just had this idea that I have to do something. I have to get involved in the public health community. And while my university offers a lot of opportunities, getting involved was not one of them. Like, we have a lot of professional opportunities within the program, but there aren't a lot of opportunities to get involved directly with the community or serve the community. So I took it upon myself, and I knew I had to start on something. And honestly, it was not like, I wasn't expecting it to be anything big. I just wanted to feel that I'm doing my part as a student. And I've always believed that even if we're students, there's still a lot we can do. It doesn't have to be that, when I graduate and when I enter the workforce, that I start impacting my community. It can be, right now at the moment, with whatever, education that I have, and whatever experience that I have. And so I guess it's one of the tips that I want to give to other students is to reach out to the connection on LinkedIn. I when I created the LinkedIn, it was actually my brother who advised me, and I was like, I was not familiar with LinkedIn like at all, and he said it's a good way to start, connecting with people. And when I did, honestly, I think people are more sort of, they say that, I'm so like I can't get enough of Instagram, or I'm so, like I keep scrolling. But that's the case with LinkedIn for me. Like when I'm not on my other social media platforms, or even when I take a break, LinkedIn is there. Like I'm not touching my LinkedIn account because it has opened so many opportunities for me, and it's I've had so many great conversations with people just like yourself. Like I've had connections who have done MPH, who are so heavily involved, in the community, and just having that talk with them have really, equipped me with the confidence that I need, with the, well, I guess, with the sort of experience that I need to, just serve my community. And I guess you always have to have that drive within yourself that you want to do something, and you just have to get started on, anything. It can be an initiative of your own, or just getting involved in a project of your community. But I guess it all comes down to if you're doing what you love, and public health is what I'm doing, and I love doing it. And so I always had this drive, even though it's a lot of work being a student. We have so many, obviously classes and a lot of other commitments. But having that, I've literally separated that part, from, I'm not doing it as a work. I'm not doing it something. It's something that, kind of fuels my drive to do more. And so I'm not looking at it as something that I have to do, but it's something that I want to do, which is one of the reasons that it makes it easier for me to be more involved. So yeah, I guess that's what you could say is the reason that I'm reaching out to people. I'm staying involved and committed to different initiatives that work towards health promotion.
Okay, that's awesome, and that's great advice you gave, and I'm glad that you are putting yourself out there, and that your brother nudged you to get on LinkedIn, and you found a lot of value, and just made connections and reached out and been proactive. All the things that I tell people to do, that you are definitely doing. So that's awesome. Um, do you have any other tips for students?
Yes, I guess since the start of the pandemic, one thing I've found very hard is to get into a routine of studying or even working. And so the first few months, I was lost. So I'm pretty sure most of us were lost as to, because we weren't sure how long, or to what extent this pandemic is gonna, last. And so I didn't have a routine, and it sort of, it impacted my mental health. And there was a lot to do because we were just shifting from in-person learning to virtual learning, which was a lot of adjustment. But I guess one and I'm sure this is not, I'm not the first person who gives this advice, but I guess the more we hear it, probably like the more impact it's going to make. Because when I heard people say get into a routine of studying, make a routine for yourself, it's sort of I didn't like it because I was just, not in a good place mentally. And I was like, well, I'm just going to give myself some time to sort of, adjust to things. And that's completely fine. I'm glad I gave myself that time. And that's my advice to everyone else that, if you're not ready to get into a routine, if you think that, the stuff or the routine that you currently have, even though if it's not ideal, if it's not waking up early and then going for a walk or run, those are ideal things, and we want to achieve those things. But if that's not the case, it's totally fine to give yourself some time, and find the reason why you're not ready to get into a routine. There's a lot that's going on in our personal life, or maybe it's something that needs fixing in our professional life. And so going, getting to the root of that is really going to help you, get into a routine that works for you. It may not be ideal for me or for someone else, but it may be, what you need. And so as long as you have that routine, I guess it really gives you a lot of time for yourself, and then for to spend quality time with your loved ones, which is very crucial, especially at this time. And so yeah, that's the tip that I want to give up to anyone out there, that give yourself some time, and then get into a routine that works for you. It doesn't have to be the ideal routine of a like study during the you know morning hours and then go early to sleep. And while that's very encouraged, I guess if it doesn't work for you, it doesn't work for you. Personally, I'm a night owl, so I tend to study better at night, and I make sure that I get my sleep in the morning. I make sure that I get that 8 hours of sleep, which is important. And now, after my classes are done, I know that I have to get back to the routine of sleeping early at night. But it wasn't working for me during the semester, so I knew that instead of sort of pushing myself for something that wasn't working for me, I adjusted to things that was working for me. And I'm glad that I can say that I ended up with grades that I'm very happy with, and that is the result of me getting into a routine that worked for me, that may have not been ideal for someone else.
Yeah, and that's awesome, awesome advice, and I'm glad that you made your routine and you're able to get some success and some wins out of it. Um, uh, I always find it interesting because I was definitely a night owl when I was in my undergrad MPH time, but now I go to sleep at like latest 10:30. So it's like very interesting. So I wonder how that would evolve for you, but we will see. We will see.
Yeah, yeah, I guess it's gonna change a lot after graduation, but I think it sort of depends, because the people my connections that I sometimes speak with, they're doing their MPH or their PhD. And it's kind of interesting to have them say that undergrad was tougher for them than their MPH or their PhD. And I asked them why, and they say it's the flexibility. In grad school, you have a lot of flexibility around your hours and the classes that you take. And so it kind of gives me some sort of motivation that, okay, once I'm done with my undergrad, I may have some more time, to and more sort of control over my schedule. But I'm happy with the schedule that I have right now. It's not too hectic. We have some flexibility around it, but obviously with online learning, I'm sure a lot of us have adjusted by now. And now my concern is adjusting back to in-person classes. But I guess it's the hope. I'm not sure if we're gonna be able to get in fully in-person classes by September. But with vaccination rates going up, it's I guess it's still something we can look forward to.
Yeah, definitely, definitely promising, promising for sure. Tell me a little bit more about the Connect Public Health Leaders. How do you go about founding that and becoming the president?
Yes, that's an interesting question. So I formed. It was first known as Connect Public Health Leaders, and it's a registered organization with Ryerson University, as well as we work independently as well. But for now, I'm mostly focused on the organizational aspect of it with Ryerson, because I just want to sort of get the legs up from ground, within the university campus, and then sort of focus on a community level. But uh, the reason we collectively within my the people that I work with in Ryerson, we came up with the decision that there's a lot of need for health awareness, health issue awareness. And so we already had a couple of clubs doing public health initiatives. So I took it upon myself and I said, okay, you know what, let's to be encompassing of all health fields, let's change the name, let's change the purpose. Not a lot, not by a lot. The only thing we're going to change is we're still going to address, analyze, and tackle these issues. But instead of specifically focusing on public health issues, we're going to focus on health issues, in a more general way. And so, obviously, public health is part of it. We are now focusing on much more broader issues. Again, you know, which is immigrant and refugee health inequities is one of them, and women in healthcare, and a lot more, which is to come. We're still working. I just introduced the executive team to my LinkedIn family. And so I'm so happy. I look forward to our first executive meeting, which is set to happen in a few weeks. So we are planning to have at least two conferences in our during the academic year. And we have 9 schools within our faculty, which is called Faculty of Community Services. So we want to have, we want to have issues from all these 9 schools. We want to bring in students to, speak with us what the issues are in their field. I can speak for public health. I know what the issues are because, like, by now I'm sort of, I can't say like an expert, but at least like I'm familiar with more of the issues. But I don't know what the issues are in the urban and regional planning field, or what the issues are within the nursing field. So our focus is to include the 9 schools within our faculty, bring them together so that they can talk to us about the issues that they're facing, issues that they need awareness in their fields, and then we're going to bring in professionals to speak with us about ways and different projects in the community, and obviously methods that students and professionals can get involved and make a change. So that's still yet to happen in the academic year, but I look forward to it. I guess I could say the hard part is done, because I love my executive team. They're really hardworking, very accomplished students, and so that is something I really look forward to achieving in the next year.
Yeah, well, that's very exciting. I'm glad that your executive team is all set and ready, and you're going to meet in a couple of weeks. And I wish you the best of luck with those two conferences, and I hope that you all are able to have very successful and fruitful and great conversations in all those platforms. So
That's the hope. Thank you.
yeah, you're most welcome. You're most welcome. So I know you also wanted to talk a little bit about health inequities in Canada. So I'll just open up the floor for you to share.
Yes. I guess the reason I like your audience might have the questions that why I've been talking so much about immigrant and refugee health. It's because well, the first reason is that it's personal. It's close to me on a personal level. As I said, I immigrated to Canada back in 2014. So there were a lot of sort of, I could say, inequities and discrimination that I faced, and not only in healthcare. While a lot of it was, in reaching, accessing healthcare resources. I also faced it in high school, and I could say, even in the community and organizations that I've worked with. Uh, that's basically the reason that I'm heavily involved in organizations that work towards addressing these issues. But uh, the reason that it's kind of become more of a focus to me, especially in the last year, it's because of the COVID-19 pandemic impact that's been like the community's been hit hard by COVID-19 pandemic. The infection rates have skyrocketed in these communities, and they are barely making the news headlines. Like I could. It's just that for me, it's while it's close on a personal level, but it's also close on a professional level, because for us as public health professionals, we're taught to stand for and advocate for people who may not have that voice, and so to see that it doesn't make the headlines, nobody's talking about it, there aren't any funds invested towards it. It's a lot to take, and as a immigrant and as a public health student, I think the platforms that I have, and like your platform that I'm in right now, I think these are my opportunity to speak for that, and to sort of um, at least do my part to say that the government is not haven't done enough and is still not doing enough for the refugee and immigrant population, because they are the lowest income population in Canada, and they are working, especially during the COVID-19 pandemic. They have worked in the highest risk settings. Those are like the companies that, and they work like night shifts. They work in places where social distancing is not really an option, and so obviously we can expect high infection rates in these communities. And when they do get the COVID-19 infection, there isn't any resources that they can reach out to. And obviously their housings, they don't have like a separate room, or a separate bathroom to quarantine at. And so obviously we can expect that now the whole family is infected, and then we see, and obviously the rates of death in these populations is also high. And so these have not made the headlines, and we don't see any government funding go towards specifically that. Okay, you know what, these communities are facing these hardships, and so we have dedicated this funding, or even this project or this campaign. So that's I guess something that really needs awareness, and the government needs to work towards it. And I'm glad that the organizations that I'm involved with, they have done a lot to sort of bring awareness to it. One of the organizations that I'm involved in, I recently finished a campaign which was called Our Shot campaign, and so the purpose of it was to bring in professionals to speak about some of the misconceptions about COVID-19 vaccine that's going around. We've had a lot of rumors and misconceptions in the community about what the COVID-19 vaccine can do to your body, which obviously been denied by the scientific community. But we still we still can't just say that what those are not true and not acknowledge why it's not true, because not everyone has the same level of knowledge. We're obviously we know a lot about it because we're in the field, but not the most of the public, they don't know about it. And so it's our job to bring that awareness to it and bring professionals who can say it in words that are understandable to that community, and not we have a lot of words like pandemic was like we mentioned earlier. We didn't know about it. I didn't know about it, and so most of the community, they didn't know what that word meant. And so that was a successful campaign because we brought in professionals that spoke about those misconceptions, like if you receive the COVID-19 vaccine, then you are injected with the live virus, which obviously is not it's partially true, but it's a weakened version of the virus. I'm not gonna speak too much about that, but I guess my the reason that I brought this up is that the organizations that I've worked with, they have tried their best, and with the resources, the limited resources that we have, and most of us are students in different fields, and so it's very I guess I could say sometimes it's emotional, but it's also so heartwarming to see that most of these organizations are run and led by students themselves. And so I'm hopeful for a better future where we are actually we no longer need to advocate for very common things like this community is facing so and so hardship. We need funding for this. I hope that it's not in the future that we talk about these things. I hope that in the future our governments, people, they at least take a hold of that, and before we even bring that awareness to it, they do their part. Because now what we're doing is we are bringing awareness to what they should already know, and they do know, but I'm not sure what the reason is that not enough is being done. But I guess we're hopeful for a better future. And with things that I see around me, professionals just like yourself, or students who are still in the field and they don't have much, but with the limited resources, that they still have taken it upon themselves to start initiatives that address these issues. It's really great to see a lot happening for the community, for the betterment of the community.
Yeah, and shout out to all you students doing this work. It's very important work, and I think as you're saying, like you have to take your time to be on whatever platform and share and raise up the voice of this issue or this opportunity where we can really impact change better. So thank you for bringing that up, and I definitely hope that there is progress and that you and all the wonderful students and other professionals out there working to fight on this front of making some progress as we definitely understand that that needs to happen, because I've seen that also in North Carolina during the pandemic, the misinformation and just a lack of understanding of the vaccine and COVID-19, and just not having the policies in place to really protect these people when they, if they are exposed or if they have a potential exposure, and,
Yes, yeah.
yeah, and all these different issues. So thank you for sharing that. So in the pre to this interview, I sent out some questions, and you had a question for me, and it
Yes.
was, why should one consider pursuing an MPH? So firstly, I wanted to ask, is it specifically for you?
Yes, yeah. But I think a lot of your audience and people who listen to this out there can relate to this question, because I see a lot of students who have done degrees in health sciences, life sciences, and in different fields are now pursuing Master of Public Health, and it's kind of interesting to me to know what kind of education one receives in doing an MPH, because there's a lot of interest, and the people who are pursuing these MPS, they come from a variety of backgrounds, and so that's why, like, it's sort of piqued my curiosity of, like, okay, you know, what is different about it, because I want to, like, personally, because I'm in doing my undergrad in public health, which is sort of like a original, as I said earlier, a new program in Canada. Even a lot of the programs are, you know, were graduate. So I sort of, I guess, want to get an idea of how different or how similar it is in terms of the curriculum. And also, you know, as I said earlier, I do, like, it's I am considering doing an MPH before, you know, I sort of, you know, get into the whole process of applying to med school. So I'd really love, you know, your input because you've done an MPH. So I'd love to hear more about it.
Yeah, definitely. Thank you for that more context. And as I definitely agree that the MPH is a master's degree where there are a lot of variety of people coming in from different fields to do it, or switching over from career to come into public health. And I think that in itself creates an opportunity, because I think when most people think about going from like undergrad to masters, you think about, okay, undergrad, you're thinking about a lot of different things, and your masters, you're thinking about a little different things. But I think the masters of public health is totally different in the sense that you're getting general knowledge, general skill sets on a lot of different things. And then as I'm saying that, I think it's important for people to go in and understand what they are trying to get out of it, because I think there's so many different things that you can get out of it. So as you're going on LinkedIn and looking at people's profile and seeing their career trajectories and thinking about what roles they're in, and what type of MPH they got, or the concentration in the MPH, or what experiences they got while they're doing the MPH, I think it's important to think about that, because I don't advise going into MPH how I did it, because I did it out of like panic, and like this was the only degree that I was going to be able to do at the point in time. I would not advise someone to do that. I would advise to take a gap year, because it's a big investment, and I would want someone to go into that, in that investment in education, really knowing, or at least having an idea or a direction of what they want to get out of it, so they don't go in there, because there's just so much for you can learn in the masters of public health. So really understanding what you are going in to gain, and knowing that. And then as well, the masters of public health just allows you to connect with a lot of different people. It gives you opportunities to build on experiences, to be able to speak to new projects and work on more projects, and really understand what it takes to be more so than a bachelor's of public health. But I do see a lot of people with bachelors doing a lot of great work in the field. But I think the master just elevates your skill sets and gives you more experience. And I always think it's like what you put into it, and like knowing yourself, you're someone that's gonna go out there and do things, and join organizations, and look for different opportunities. And I think that in itself would allow you to do a lot of great things with your master's of public health. And even if you do go on to medical school, which I hope you don't, I think it's a great stepping stone, and it puts you ahead of doctors and thinking about a lot of different things, as well as I feel like it gives you a better perspective of what health administrators are thinking about when you're a doctor. Um, so I think that there's a lot to say about the MPH, and I feel like it's all contextual on what you want to do and what you want to get out of it. But I think there's you can do so many different things. But really, I would say if you want to get your MPH, know what you want to do, or at least have some sort of direction on what you want to do. Know, like, have an idea of roles afterwards that would interest you before you go in, because there's a lot that you can go in there and get distracted or get overwhelmed. So knowing what skill sets or what experiences you really need to get you where you need to go, I think the MPH is a great way to gain those skill sets and really build upon what you have learned in your undergrad, or just add to whatever skill sets you have had in what other roles or what other degree you got. So I would share that.
Well, that's definitely a lot and interesting, honestly. I guess there's, you know, you sort of have to hear that graduate side of it. Like, there's a lot you can learn from, you know, like a Google search of what an MPH looks like. But then it's so different from when you hear, you know, graduate speaks about them and their experience. So I think I totally agree with you that, you know, before actually, you know, committing to something as big as doing an MPH or, you know, any other master's degree, I guess it's important to get, you know, a glimpse of, you know, that life. And I guess if you want to, you know, get anywhere close to that, it's, you know, to speaking to someone who's graduated from that program. So I'm glad, you had that, at least I got that little time you speak about it. And obviously I'm going to reach out in the future to have, more longer, chat about it. But I'm obviously really considering it, like seriously considering doing an MPH to see, what sort of, potential I can bring back to the community, what kind of roles I can be involved in. But yeah, that's just really interesting to see, that you have sort of a lot of options, but you also should have, as you said, sense of direction as to what you want to do at the end of the day, and if MPH is the right direction to go. And so yeah.
Yeah, well, I'm glad that was helpful, and I think there's no better time to go into public health than now because all the eyes are on it. There is hopefully a lot of investments and infrastructure build out that is going to be coming in the next coming years, and I think there's just a lot of innovation that has not happened in public health that we need the new public health students and the younger public health professionals to really drive forward. So I'm excited to see what comes of the new public health and what public health looks like and how we're really focusing on it into the future.
Absolutely, yeah. You touched on a really interesting point that many people that I've, had the chance to have a conversation with, even people who have very different background, like they are working in, sort of, governmental sectors or, law. Even they have advised me to, sort of take my time before applying to med school because there's a lot for public health industry, in the coming future, near future actually. And so I guess it's really interesting, and even for anyone out there who want to pursue something other than public health, I think I know how it feels to not know what you want to do in the future or in the couple next year or but I guess sometimes it's good not to know exactly what you're going to be doing. Sometimes it's good to take your time. And so, if you're in the public health, community, if you're in the field and you sort of want to take, a different route, I guess, and it's an advice for myself too. I guess, it's good to sort of wait some time and, see what public health looks like, or, at least what kind of projects or, investments and initiatives the government wants to fund on, and there's a lot of, that that needs to be done within public health. As you said, there's a lot of, space for innovation, and we need more people to come in. We need more students, and hopefully, it's gonna look, a lot better from what we have now. But even with the limited, initiatives and projects that we have right now, we're still, doing a lot. We're still doing very, amazing work.
Yeah, absolutely. And just to touch on something like the position that I'm in right now, I had no clue existed when I graduated from a master's of public health. So I feel like just you might not know about the position that you think would be an ideal for your skill sets and your knowledge and things like that. But just going forward on like what feels good, like community health, community like based participatory research and community health needs assessment, and really like focus on community empowerment and systems change. That was what I was looking for, and like I'm lucky to find it. So I'm just saying that to say that there are a lot of opportunities that you might know about or you might hear about, even through all the extensive research, as public health is a huge field and there's so many ways to make an impact. But it is a blessing in the sense that there are so many social media people from public health on social media now, and they are LinkedIn is a way to connect with people and just understand more of the rules. So there's a lot
Yes,
of
it's
opportunities.
really a new thing. It's sort of we've heard a lot about it in the last couple of years, or at least for I've been in it for like the past 2 years. So I guess it's very new. There's a lot of room for for opportunity for to grow up in it, and so yeah, I guess, and especially the involvement and the appearance of so many people who are in the field on social media platforms is increasingly helping a lot of aspiring students who are I guess I could say I was stuck between deciding programs. I got into different programs like health studies, psychology, and many more, but they were not for me. And so I guess if I had not, stumbled upon public health and now I found out about it, I think it would have been like, it would have been sort of like a thought in the back of my mind that, what if I had been in this program, or if I had been in this field? So I think this, sort of awareness about the field itself is doing, a lot of help for people who or students who are still in high school are still deciding their career pathways. So it's really I guess great work that there's a lot of professionals out there or even students who are working towards bringing awareness to the field and sort of showing a glimpse of what it is to be either a public health student or professional, or what you can do with a degree in public health.
Yeah, absolutely agree with that. Well, thank you so much for coming on the show. I would like you to share where people can connect with you.
Sorry, could you repeat that again?
Yeah, where can people connect with you?
Sure, yes. So people can connect with me on my organization page, which is called Connect Health Leaders on Instagram, as well as on LinkedIn. So it's like a whole one word, Connect Health Leaders, no space, nothing. And obviously my Marwah Azizi, I'm on LinkedIn. But my Instagram is more personal. I've tried it to, sort of put in all the content that I've worked towards creating in the past 2 years and to that organization page. So it's definitely a chance for them to check it out. And obviously you're one of them. You're in that series, so it's I personally learned a lot from reaching out and putting that series together. And there's a lot of great resources and information. So as to even like a question, why pursue public health, which is the one question that I guess I've asked all 6 guest speakers. So they can reach out, there, or if they want to connect with me on LinkedIn. It's just my first name, Marwah, and my last name, Azizi, and I'll be more than happy to have a chat with them or, help in any way I can.
Awesome. Well, thank you so much for coming on and sharing your story and sharing your journey up to now. I look forward to seeing where you end up in the future and all the great work that you do.
Thank you, Mari. I really appreciate you opening your platform to students, and I'm really excited to see you bring in more students, and sort of hear their story and their experiences, because it only adds value to our experience, to our knowledge. And so I'm excited, and I look forward to following on your series. So that's wonderful. Keep it up, and thank you again for having me.
Yeah, my pleasure. Thank you so much for coming on.